Hello everyone, this is Henry of the Smart RN channel. In today's video, we are going to look at ventricular fibrillation, or in short, V-Fib. Now, V-Fib is a heart dysrhythmia where the ventricles or the heart's lower chambers are experiencing multiple chaotic impulses. And these multiple chaotic impulses are produced or are caused by multiple cells which are firing rapidly and independently. So when you have multiple cells firing independently, that means on their own and without regard to other cells, then we are going to have a chaotic situation within the ventricles. And as such, V-Fib is life-threatening. In other words, it can cause death if not treated immediately. Why? Because there is no actual cardiac output that is produced by these particular ventricles. Remember, the ventricles pump blood. The right ventricle pumps blood to the lungs for oxygenation, and the left ventricle pumps blood to be able to oxygenate the various parts of the body and even supply the nutrients. So if there is V-Fib, there is no actual cardiac output. So the various parts of the body are not being perfused, including the heart and even the brain. So this is going to result in immediate death if not treated immediately. In V-Fib, there are no P waves nor QRS waves. Instead, if you look at the EKG or the electrocardiogram, you are just going to see this line, which may either be caused or it may be fine. The ventricles are just quivering or shivering, and as such, they are not pumping any blood. Remember, we said that when there is this shivering or quivering, we might end up in the pooling of blood that result in clot. So no blood is being pumped out of the ventricles, and this is very, very dangerous to the survival of this particular patient. One of the two major signs that you are going to see in this patient is loss of consciousness, and also there is no pulse. They are not going to have a pulse at all. Now, what are the causes of V-Fib? We have got a number of things that can send our hearts into V-Fib. One, we have got hypovolemia, reduced volume in the circulatory system. So we are not going to have enough perfusion to the various parts of the body, including that particular heart. So that our heart is going to enter into V-Fib if there is hypovolemia. We also have hypoxia, reduced oxygen volume in our blood. We have acidosis, increased acidity in our bodies. Hypo or hyperkalemia. Hypokalemia is decreased potassium, or hyperkalemia is increased or excess potassium in our bloodstream. So this can send our hearts into V-Fib. We have hypothermia, decreased temperatures. Cardiac tamponade. Now, cardiac tamponade is the collection of fluid around that sac that encloses the heart. So when fluid collects in this particular sac, then our heart cannot be able to pump. So the result of this, V-Fib. Ventricles are just going to quiver because they do not have that ability to expand, to be able to contract and expand and pump this blood into our system. So cardiac tamponade can also result in ventricular fibrillation. Myocardial infarction, the death of cardiac cells as a result of decreased perfusion and therefore decreased oxygenation. So when cardiac cells die, then it means there is no contraction to be able to pump blood. So the result, this might send our hearts into V-Fib. We also have sepsis. This is a deadly condition that can result in septic shock. And when you have this, the heart is likely to enter into ventricular fibrillation. We also have hypoglycemia, reduced blood sugar in our system. Pulmonary emboli. This is a blood clot that just broke loose and then went unsettled or lodged into the lungs, and it prevents our lungs from adequately oxygenating our blood. So with the pulmonary emboli, we can have reduce oxygenation in our blood, this hypoxia, which will cause us to enter into V-Fib. We also have the coronary artery disease, or CAD. With the coronary artery disease, for example, if there is a blockage in the coronary artery, there is inadequate supply of blood to the heart, and as such, inadequate oxygenation of the heart. So the heart can enter into V-Fib as a result of this CAD. Now, what is the treatment? V-Fib requires CPR immediately, cardiopulmonary resuscitation. We require to initiate chest compressions immediately to help save this particular patient. So when we have a patient in V-Fib, as I say, there is no pulse, there is loss of consciousness, we must begin CPR immediately, cardiopulmonary resuscitation. And I want to mention three things about CPR. Number one, when you are performing CPR, ensure that the chest compressions are at least 2 centimeters deep in case of an adult. They should be at least 2 centimeters deep. And when you perform chest compression, allow chest recoil. So you press and allow the chest to recoil completely as you continue with this CPR. This will ensure adequate perfusion in this particular patient. So when you are performing CPR, perform chest compressions of at least 2 centimeters deep and allow complete chest recoil before you press again. Number two, perform these compressions at a rate of at least 100 beats per minute, but not more than 120 beats per minute. And number three, perform exchange. Let the compressors change. Change compressors so that this is to prevent fatigue. One compressor can become fatigued, and when somebody is fatigued, then is not providing those high quality CPR compression. So change the compressors. When one becomes you are getting tired, change to another. But this change should only take around 10 seconds to do so. Or you can change compressors when we are performing defibrillation. So another thing that we do to try and treat this V-Fib is defibrillation. We use a defibrillator to send shock waves to the heart so that we try to restore that particular rhythm. Remember, defibrillation should be done within 2 to 3 minutes of V-Fib. Remember, because continued V-Fib, there's no cardiac output. So we must try very hard to restore heart rhythm immediately to enable this patient to be perfused. So defibrillation should occur within 2 to 3 minutes of V-Fib. So when we are performing this, when we are defibrillating, when the defibrillator is sending the shock waves, that's the right time to be able to change these chest compressors. During this CPR, we can also use medications together with this CPR. As CPR is going on, we can also administer this medication. For example, vasopressors like epinephrine, we require this to increase contractions, that we can have a pressure that can help to pump or to send blood to the various parts of the body. So we have epinephrine, or epi as we call it. We also have amiodarone, which is an antiarrhythmic. We can also administer this medication to try and help this heart to restore a rhythm, to help this patient to get adequate perfusion. So during CPR, we do defibrillation and medication. But remember, the first line of treatment is CPR, immediate chest compression. And these are high quality chest compression that can enable us to send that perfusion to the brain and even to the other parts of the body. And if this patient comes out of this V-Fib, then you can also consider an implantable cardioverter defibrillator. This is an ICD. It is put under the chest just to monitor our heart, so that every time our heart develops a dysrhythmia, then this ICD can be able to fire to try and restore a normal rhythm within this particular heart. So we can consider implanting an ICD into this patient so that they can have it can monitor their rhythm at all times. Now, what are the nursing interventions in V-Fib? The major nursing intervention is in V-Fib is number one, activate the emergency. Code blue. You activate the code blue because this is an emergency. This patient is going to die if nothing is done. So activate the emergency and at the same time initiate CPR. Begin chest compressions immediately. So as you activate the emergency, as you call for help, that code blue begin chest compressions immediately until help actually comes. So CPR is the immediate treatment for these patients in V-Fib because this is life threatening. So that brings us to the end of this video on ventricular fibrillation. So as always, drop a comment, like this video, share this video, and if you have not subscribed to this channel, please do so. From me here, it is goodbye.